Hello and welcome. Today, we're going to discuss a very common condition that affects millions as they age of presbycusis, or age-related hearing loss. We'll explore what causes it, how it affects the ear, and what can be done to manage it. So, what exactly causes presbycusis? It's a complex condition with multiple contributing factors. The primary cause is the gradual deterioration of the hair cells within the inner ear. These hair cells are responsible for converting sound vibrations into electrical signals that the brain interprets as sound. Genetic predisposition plays a significant role, meaning if your parents or grandparents experienced hearing loss, you're more likely to as well. Other factors include prolonged exposure to loud noises throughout life, certain medical conditions like diabetes and high blood pressure, and ototoxic medications, which are drugs that can damage the inner ear. To understand how presbycusis develops, let's look at the pathophysiology. The inner ear, specifically the cochlea, contains thousands of tiny hair cells arranged in rows. These cells are finely tuned to respond to different frequencies of sound. As we age, these hair cells become damaged or die off. This damage typically starts at the base of the cochlea, which is responsible for processing high-frequency sounds. As more hair cells are affected, the ability to hear a wider range of frequencies diminishes. Additionally, changes in the blood supply to the inner ear and alterations in the neural pathways that transmit sound information to the brain can also contribute to presbycusis. Presbycusis is incredibly common, affecting a significant portion of the aging population. It's estimated that approximately 1 in 3 adults between the ages of 65 and 74 experience some degree of hearing loss. This prevalence increases with age, affecting almost half of individuals over the age of 75. While it is more common in older adults, it can sometimes start as early as the 30s or 40s, especially in individuals with a family history of hearing loss or those exposed to excessive noise. The signs and symptoms of presbycusis develop gradually, often making them difficult to notice at first. Common symptoms include difficulty hearing high-pitched sounds, such as women's voices or birds chirping. You might find it hard to understand conversations, especially in noisy environments like restaurants. Other signs include asking people to repeat themselves, feeling like others are mumbling, and having trouble hearing over the phone. Some individuals may also experience tinnitus, a ringing or buzzing sensation in the ears. Diagnosing presbycusis typically involves a comprehensive hearing evaluation performed by an audiologist. This evaluation includes several tests, such as pure tone audiometry, which measures the softest sounds you can hear at different frequencies. Speech audiometry assesses your ability to understand spoken words at various volumes. Tympanometry measures the movement of your eardrum, which can help identify other potential ear problems. Based on the results of these tests, the audiologist can determine the type and severity of your hearing loss and recommend appropriate management strategies. While presbycusis is generally categorized as age-related hearing loss, it can be further classified based on the specific part of the ear that's affected. Sensory presbycusis involves damage to the hair cells within the cochlea. Neural presbycusis involves a loss of auditory nerve fibers. Metabolic presbycusis affects the stria vascularis, which provides nutrients to the cochlea. And finally, mechanical or conductive presbycusis involves changes in the physical properties of the cochlea. However, in many cases, individuals experience a combination of these types. Unfortunately, there is no cure for presbycusis that can completely restore hearing. However, there are effective treatment and management options to improve hearing and quality of life. The most common treatment is hearing aids. These devices amplify sounds, making them easier to hear. Different types of hearing aids are available, and an audiologist can help you choose the best option for your specific needs. Cochlear implants are another option for individuals with severe hearing loss. These surgically implanted devices bypass the damaged parts of the inner ear and directly stimulate the auditory nerve. In addition to these devices, communication strategies, such as asking people to face you when speaking and reducing background noise, can also be helpful. While we can't completely prevent presbycusis, there are steps you can take to protect your hearing and slow its progression. The most important thing is to avoid exposure to loud noises. Wear earplugs or earmuffs when you're in noisy environments, such as concerts, construction sites, or while using power tools. Monitor the volume of your headphones and avoid listening to music at excessively high levels. Managing other health conditions, such as diabetes and high blood pressure, can also help protect your hearing. Regularly visiting an audiologist for hearing tests can help detect hearing loss early, allowing for timely intervention. The prognosis for individuals with presbycusis varies depending on the severity of the hearing loss and the effectiveness of the management strategies. While hearing loss can impact communication and social interactions, Hearing aids and other assistive devices can significantly improve quality of life. Recent research is exploring new ways to protect and restore hearing. This includes research into regenerative medicine, which aims to regenerate damaged hair cells. Gene therapy is also being investigated as a potential treatment for certain types of hearing loss. Additionally, researchers are working on developing more advanced hearing aids and cochlear implants that can provide even better sound quality and speech understanding.